Okay, so I go in, I ask Dr. Bob, I need, we've already given a list of questions to our patients to ask in a consultation. But the CAD CAM side hasn't been something we touched on, and that's why we wanted to invite you on this, and was really excited to have your expertise as a professor, as a practicing clinician, as an early adopter of this technology, and seeing the growth of where it's gone. So now I say to Dr. Bob, all right, I've asked my list of questions. I get to the CAD CAM side, and he says, yes, I do CAD CAM. And what would be a good follow-up question? How many, how long, how much has that changed your practice? What does that look like for you? Give me some of those questions, because again, we want to empower that patient. So when they are sitting between, they've gone to 5 consultations, right?
Yeah.
And now they have to narrow it down. Maybe they like all 5 dentists, and we've given them the list of questions. Now we're at the CAD CAM piece of this. What would be some of the follow-up questions if they say, yep, I use CAD CAM?
Well, I would say, for what specific type of restorations do you really use CAD CAM? Do you use CAD CAM for a small onlay or for a single unit crown only? Or CAD CAM is kind of the way, or digital technology, the way you treatment plan, the way you design provisionals, the way you manufacture the final restoration. So we just published a paper. It's actually a full chapter, and we titled it The Digital Clone. So our vision now is that every patient that comes in receives a CBCT, right, a cone beam computer tomography, and an intraoral scan. And then we take some portraits, okay? And then we put all these files together, correlating it. I call it like making a club sandwich. It's different layers.
Okay.
So the patient can be here for half an hour, consultation, and leave, but we have all the information that we need for the best treatment planning possible. So this is technology being used not only for the production of the final restoration, but from the beginning, for gathering as more information as possible to start as clinicians with your team of specialists treatment planning, discussing. Same example as you said, the oil industry getting together. Same thing, okay, what do we see here? What would be the best treatment plan with All-On-6 would work here? What about the restorative space? What about the phonetics? What about the patient's aesthetic concerns? So this digital clone gives us much better sources of information from our own patient to treatment plan, and then also to avoid possible mistakes that if I don't go through this process, I wouldn't be able to detect them.
Yeah, you might not even know that issue exists.
Exactly, because the information is there, but it's separated, so it's not that useful. So I would ask, up to what level are you really implementing these digital technologies? And what it has changed since I started in this before was only for the production of the final restoration. Then we started working also in the provisional restorations, right? And now,
which is what I'm in, right? The temp, right?
The temp, exactly.
Right. I haven't
Temporary
got
provisional
my
restoration.
second PMMA
exactly
right now, and because of that, and we've in some of our appointments, they've seen some of the crazy technology and scanning. But you're saying that at one point, and I didn't mean to interrupt you, I just want to make sure I'm following your path, that at one point it was just for your final teeth, and now it's for the process.
For the entire process, not only for the provisionals or temps, but from the treatment planning. And there was a very good paper I review one of these days mentioning that the patients are more and more now used to use applications or on their smartphone. So if we have these types of tools to explain them the treatment, they are more informed and they are more confident in making the best decision for the treatment. So it's also important how we can use this technology to have the conversation with the patient and explain exactly what we see and the different options, and that's something that we should use technology to have a better communication of the treatment with the patient.
Yeah. And so a good question to ask in my example, Dr. Bob, is what do you say you use CAD CAM technology? Explain to me throughout the process, where do you use CAD CAM technology?